This is CBS 7 Midday, your eye on West Texas.
Welcome back to Midday. Joining us now is Dr. Robin Rutherford with The Art of Dentistry. Thank you so much for being with us today.
Morning.
There was a recent study that was put out, and it said that basically x-rays could cause brain damage, and you wanted to clear up some things about that today.
Right.
Yes.
Yeah, I wanted to say, first of all, that dental x-rays are very safe. And there are things that I disagree with from what I read this study that people are asking us about in my office. But first of all, the amount of radiation that it takes to produce a dental x-ray has gone down, down, down during my career.
Right.
For example, there's been several different times during my career when new x-ray film came out, which is more sensitive. In other words, less radiation, less exposure needed to make the picture. And so we've actually had to turn down the machines down, down, down. Mm-hmm. And in fact, the last time this happened, instead of the buzz, you know, when they push the button to take the x-ray and it goes, now it's like,
Okay, just
so
a second.
Yeah.
Big difference.
Now another big change is that now they've actually switched from having x-ray films where you hold the x-ray up to the light or the view box with a light behind it to see. Modern x-rays, the latest, is digital. In other words, you take the picture and it appears on the computer. Mm-hmm. So digital x-rays use 1/7 the exposure of what it was to take an x-ray using film. Mm-hmm. So again, when you cut it down that low, then you take 1/7 of that. We're probably using, I don't know, 1/20th or 30th or 1/50th of what was used to take a picture way back when.
So the most important thing to take out of this is it is more important to get the x-ray, especially if you're in any pain, to see exactly what is going on in there, and the radiation that you're exposed to is very minimal.
Right. Well, and if you wait until you are hurting and wait until you're swollen, you know, before you show up for an exam or x-rays or anything, then you have an abscessed tooth probably. You should have caught it when it was just a small cavity. Right. Well, that's the benefit of having routine x-rays and exams, to catch something before it's a big deal. Right. So, you know, it's cheaper, better, everything about it.
All right. Thank you so much for talking to us about that. I hope that cleared up any questions you may have. Of course, you can always go to dentaldoc.com to talk to Dr. Rutherford yourself or get more information. Thank you very much. Appreciate you being here.